This is Sandy Wright-Leonard, and I'm the educator for One Day Surgery Downtown. You guys asked for more information about what we needed in a triage process and what that looked like. To help you understand, I want to give you a little history. Our previous documentation had what they call wizards, and in those wizards, we put all of the questions you needed to care for your patient. Because of that, I was able to create a wizard that contained all of the interview type triage questions that you could ask without having the patient physically present, like vaccinations, allergies, and so on. When the nurse completed the wizard, there was an orange halo around it, and it gave a visual for the primary nurse that those questions had been answered, whether it had been done the day before surgery or the day of surgery. Why is this triage so important to us? Since our APAS department does a chart review for the majority of these patients, a lot of information can be missed. This information helps us to be more efficient. It helps us with staffing and with patient care. We find out a lot of information, especially DHR issues, sensory issues, H&P issues, illnesses, cancellations, during that triage process, and it also helps the charge nurse when they're making patient assignments. During the transition to all scripts while we were building, I tried to explain this process. However, South doesn't use this process because their CRNAs called their patients the day before, and they were really pushing to be standardized. And since we hadn't worked in all scripts before, we were still wrapping our head around how the application worked, as well as trying to explain what we needed. It was beginning to take shape, and you'll see that on the second tab, but there was such a huge time restraint that we ended up with what we have. However, once we began working in the application, it quickly became clear that we nearly eliminated the triage nurse role, and it's been difficult. What's going on currently? Right now, the nurses in Louder are documenting on paper and then transcribing this information on the day of surgery. The Benjamin Russell nurses no longer attempt to do a triage the day before surgery. And if they have a triage nurse on the day of surgery, that nurse is more of a primary nurse because it's difficult to do just those triage questions. And this has caused a decrease in the number of staff members willing to work extra to help out. It's much easier to triage multiple patients than to be the primary nurse of a few. So that's the background. So let me give you a visual of what I'm talking about. This is an example of the triage sheet that they're using currently in Louder. All of the information that I have on this sheet are things that they've actually gotten from patients during their triage process. At the top, you'll see that the mother is still the legal guardian, but the grandmother has physical custody. In many family custody situations, they don't go through DHR. And since anybody can bring a child to the clinic does not ask if they're the legal guardian. So there won't be any DHR information located in the chart. Unfortunately, it's only when they talk to someone from One Day Surgery or they come on the day of surgery, they find out they are not authorized to sign the consent. That means that this primary nurse will need to call the prison to get in touch with the warden to go and get the parent to bring her to the phone and let the doctor talk to her about the procedure and then get verbal consent. That lets the charge nurse know that this probably should not be a first case. Or if it is a first case, the nurse who has this patient should not have another first case to get ready, or they should not have a quick district with a lot of patients that turn over quickly. Let's look at how this information looks as is documented in the application. On the day of surgery, it's difficult to see which questions have been answered. For example, there's verbalize. Here's the information about the ketogenic diet. This is the second tab I was talking about and trying to group all of those questions together, but it's still spread out a whole lot. I requested a second structured note so that we wouldn't have to make changes to the current note since it works for South. I did a mock-up of what that could look like, and it's basically just taking all of those interview type questions and putting them on one tab, one pre-screen tab. So when the nurse opens the record, it's just a little easier to see all of the questions that have been answered, and they can review this information with the caregiver. I don't know if Epic would be able to accommodate us, but it is an issue, and it is something that benefits our department a whole lot. So just give me a call if you have any questions. Thanks.